But the first thing that, I'm laughing watching that clip because there's a point where the CEO gives his BS answer and then Bernie interjects to say that's a whole, and he cuts himself off, but he wants to say that's a whole lot of BS. But he controls himself there, even though I don't think he needs to. He should let loose sometimes. But so a couple of things on the stock buybacks. We're going to get to more details in the next clip, which goes over just how Moderna as a company, how much help they received from the US government and what they are doing with all their money now. So wait for that in the next clip. But on the CEO not committing to lowering the price in America, of course, why would he? This is where the guardrail, America is the place where corporations go to make the most amount of money possible because the guardrails are completely off. There are very little restrictions on massive corporations in the US compared to other countries. He has no incentive to put people over profit. The only way to control these companies is by having proper regulations in place. So even, apart from anything else, it's worth noting here that you can't shame these people into doing the right thing. You have to make it illegal for them to do what they are doing now, and only make it possible for them to make as much to make the money that they do make under certain restrictions that still ensure that people are able to get the medicine they need. And even apart from all that, healthcare should not, the profit motive should be completely out of healthcare. I mean, that's, again, kind of a separate discussion, even though not really. It is part of the discussion. But the idea that there is a billionaire now because of a vaccine, does he deserve to have do the people that made these vaccines, do they deserve to have a good life? Of course. Do they need billions of dollars while people can't afford the medicine that they created? No, that doesn't make any sense. And I hope we can all agree on that. But let me, before I get to the next clip, this is a bit of the information around how much help Moderna got from the US government. So this article from healthaffairs.org, where they're arguing that President Biden already has the COVID vaccine recipe and he should share it. So from their perspective, he already has the ability to do this. But they write here, how did the HHS, the U.S. Department of Health and Human Services, come to hold vital information on Moderna's vaccine recipe and the legal right to share it? HHS invested more than $1 billion in the development of Moderna, quote unquote, vaccine, and its scientists were involved at every step of the way. One of HHS's constituent agencies, the National Institutes of Health, NIH, co-invented the vaccine with Moderna. HHS paid for all and ran many of the clinical trials that proved the vaccine is safe and effective. The HHS funded Moderna's scale up and scale out of manufacturing. As Monsef Slaoui, former head of Operation Warp Speed, said last year, HHS held Moderna by the hand on a daily basis throughout the entire process. And now Moderna turns around and wants to quadruple the price of the vaccine. Again, because they can, which we'll get to at the end. My criticism that has not been, as far as I've seen, has not been mentioned by anyone else. But let me get to the next clip here. So this is going to be, let's see him here. Here he is. Dr. Christopher Morton. So he is a Columbia Law School professor trained as an organic chemist and a leading voice on equitable access to medicine, and he was one of the witnesses here during this hearing.
Moderna has proposed massive price increases from $20 or $30 a dose to $110 or even $130, though each dose costs less than $3 to make. Higher prices mean higher insurance costs, including higher Medicare premiums. It was the US government, the American taxpayer, that spent billions. It was government scientists that toiled alongside Moderna's. We designed and ran Moderna's early clinical trials. We gave Moderna money and resources to expand its manufacturing. The National Institutes of Health was so integral that it aptly named the vaccine the NIH Moderna vaccine, built on over a decade of pioneering research into coronaviruses at NIH. To justify price increases, Moderna also points to $4.5 billion in R&D commitments this year. But $4.5 billion is easily doable for this company. In 2021 and 22, Moderna made over $20 billion in profits. The company has been so spectacularly successful that many of its executives and early investors became billionaires, including Mr. Bancel. As I speak right now, Mr. Bancal's net worth is reportedly about $4.7 billion, meaning he might be rich enough to fund Moderna's entire 2023 R&D expenditure out of his own pocket. In 2022, Moderna spent $3.3 billion on stock buybacks to enrich Mr. Bancal and other shareholders. That's as much as the company spent on R&D last year.
All right, so a lot of information there to help you understand just how much help they got from the US government to develop this vaccine. And also, I mean, the big giveaway there is they spent as much on stock buybacks to enrich their own shareholders. That is the only benefit for them. The only reason to do a stock buyback is to enrich your own shareholders. They did that. They spent as much on that as they did on research and development. Like, this is, and by the way, I watched a lot of this hearing. Some of the Republican senators, like the defense they had of Moderna and this corporate greed, this big pharma greed, is just incredible. And most of their supporters are not going to see it. They don't watch this. Most people don't watch this stuff. But, you know, if there's enough interest, I would do a separate video on all that crap, because it just seeing people like Mitt Romney and everyone else up there on the right, they defend this amount of greed by saying, well, they've earned it. They put this investment in, even though the U.S. government, again, held their hand throughout the entire process of making the vaccine. They put this investment in and they made this vaccine. And now, because interest is waning a little bit into the vaccines, or it's not as big of an issue as it once was, now is the time for them to strike and make their money. Let me show you how the media reports on Moderna's sliding profits. All right, that's how they're framing this now. So this is a recent headline just last month. Sliding vaccine sales, new costs, squeeze Moderna fourth quarter profits. Oh, Moderna's being squeezed, barely getting by. What are they making in profit? Like, I don't know, 50 grand? I mean, it's a big company, but they're barely getting by. Their profit fell to $1.46 billion. This is Moderna being squeezed. $1.46 billion in the final quarter of 2022. How can you frame this as Moderna being squeezed? Being squeezed is like barely breaking even. 1.46 billion in profit is not being squeezed, especially when you spend, what was it, $3 billion on stock buybacks, as much as you spent on research and development. You can't then say they're being squeezed when they're putting their money into stock buybacks. And again, this is AP. This is not Fox News. This is the straight news agency, AP News. Let me get to the last clip here, and then I'll get to my very specific criticism that I have not seen addressed. But here is Bernie making a very important point.
Jonas Salk, you're familiar with Jonas Salk, invented polio. Did not make billions for his invention. In fact, he gave it away. And he said, I'm so proud to have created this vaccine to save lives. Alexander Fleming developed penicillin, a huge advance for medicine, saved, millions of lives? Frederick Banting sold his intellectual property for $1 for insulin. All right. What do you think about those guys and those scientists who said, you know what? Our function in life is to create wonderful drugs that will ease human suffering and save lives, not to become excessively rich. Do you think they were crazy?
I think what they did was very noble. I think what we have to do is to invest in the technology. If we didn't have a technology when the pandemic happened, there would have been no Moderna vaccine, Mr. Chairman.
Look, we all agree that we need the technology, but what I am asking you, and some of my friends here are saying, is that the only thing that motivates you is to become a billionaire.
That's not true.
All right, but then can we have a science where people get paid well? I have no problem with Moderna making money, but you're hearing here massive cash paybacks, you becoming a multi-billionaire. Should we develop a counterculture, perhaps, which says your motive is not just making billions, but developing all of the drugs we need for the terrible diseases that this world faces? You can come up with all the great drugs in the world, we appreciate that, but if people can't access them, or they go broke, or they go bankrupt having to buy them, It doesn't mean anything to those people. And certainly, by the way, we're talking about America, the wealthiest country on earth. What about Africa and poor people around the world?